So hi everyone. So I am Dr. VC Sridharan, Assistant Professor from the SNS College of Physiotherapy. So now in this video, we're going to see about the topic which is known as spinal muscular atrophy. So what is spinal muscular atrophy? So muscular atrophy is generally an genetic neuromuscular disorder. So it is a disorder which is comprises of which affects the neuromuscular junction, which is basically comprises of the genetical factor. So in this condition, it generally progressively degenerate the motor neurons and in the spinal cord, and as well as also it finally leads to the muscle weakness and atrophy around the spinal cord, which is known as spinal muscles. So it is generally takes on degenerations of the anterior horn cells, these anterior horn cells are present in the spinal cord, and due to that it leads to the denervation of the skeletal muscles. And it is also caused by due to the mutation and also deletion of the gene which is known as SMN1 gene, which is present in our genetical factor that leads to the causes for the spinal muscular atrophy. So generally spinal muscular atrophy comprises of the different types. So it is an SMA type 1, type 2, type 3 and type 4. These are the 4 different types of the spinal muscular atrophy. Next. So what causes the spinal muscular atrophy? So generally the spinal muscular atrophy is caused by the autosomal recessive genetical disorder. So it is one of the genetical factor which is automatically gets into a recessive factor. Then secondly, it is comprises of the mutation and deletion of the SMN gene 1. And finally, it is also a genetical factor. It may be carried throughout the generation, maybe it's carried through the grandfather to father and then father to son or daughter. Likewise, it is genetically carried over throughout the factor. So generally, the clinical features for the spinal muscular atrophy is, so first one is progressive muscle weakness around the spinal cord. So generally the spinal cord muscles compresses such as erector spinae, multifidus muscle and these longitudinal ligament. So these kind of structures can be affected due to the spinal muscular atrophy. Then second one is delayed motor milestones. So generally these motor milestones plays a major role in the factor of child to an adult period. So in this condition, the motor milestones can be getting delayed. Then tongue fasciculations. Due to the tongue fasciculations affected, so these patients who are comprised of the spinal muscular atrophy, they have difficulty in the speech factor also. Then after that, it also comprises of the respiratory muscle failures. So due to respiratory muscle failure, they have a difficulty in breathing and as well as also in respiratory factors, everything. Finally, it also leads to a difficulty in the feeding difficulties, and as well as also these patients also comprises of the scoliosis. So investigations, there are vast method of investigation and diagnostic tools were present which is used to measure the spinal muscular atrophy. So according to these conditions, there are some kind of investigative methods. So the first one is genetical testing. So while testing genetically, if the patient comprises of the SM1 gene testing, so if the test that occurred in conducting for that gene, so it can shows the mutation and as well as also the deletion in that gene genetical factor. Then second one is electromyography, which is known as the EMG. So this EMG which is used to measure the muscle power as well as also the innervation and denervation of the muscle factors. Then third one is muscle biopsy. If suppose the muscle is getting into affected, so by conducting the muscle biopsy, we can use it to measure what kind of factors that affecting the muscles. And finally, we can also test the serum level. So in this serum level, we can use it to find out the creatine kinase, which is known as CK base, that levels can be elevated into moderately. Management. So generally the spinal muscular atrophy is generally managed by using some kind of drugs, and mainly for the spinal muscular atrophy drug which is known as the nusinersen. So this drug which is used to increase the SMN protein level in the genetical factor. Then second one which is known as the zolozenzima. So zolozenzima is also a drug which is used to measure the gene therapy. Then it is also in a residiplum. It is an oral intake of the drug which is used to which is used to correct the SMN2 factor. And finally, the supportive drugs which are known as the bronchodilators and antibiotics. Bronchodilators which is used to the increase the dilation of the bronchus level, and finally for the antibiotics which helps in fighting against the infections. So thank you. So see you on the next topic in the some other video. Thank you.